All right.
We're back.
Yes, another episode of the Playbook, the ultimate guide to men's health. My name is Manny, Cambra, your host. My guest here today, Dr. Dave Grosiak, owner, operator, doctor, medical professional at the ACO game day location.
That's right.
Yeah. And
White Horse Pike.
Black Horse Pike. Yeah. White Horse, Black Horse.
White Horse.
White Horse
Pike.
White Horse. White Horse Pike. And as always, this podcast is brought to you by Game Day in Swedesboro, New Jersey. We are coming to you today from the Frosted Nug in Carney's Point. The Frosted Nug, of course, is a awesome dispensary, and this has this awesome podcast studio that they generously let us use. So a big thanks to them. Big shout out to them. Today, I want to create some synergy.
Yes.
Yes, let's go.
Like
Testosterone replacement therapy with Sermorelin, Testosterone, growth.
Yeah.
Is it
Growth hormone releasing hormone.
Growth hormone releasing
Hormone.
Okay.
Peptides.
Peptides.
Yeah.
Exactly.
Different than growth hormone releasing peptides.
Yes. Okay. That's right. I was going to. Yeah. So this is like the bread and butter. This is your 1-2 punch. There doesn't really get much better than this outside of the world of anabolic steroids. Like if you're staying within the realm of humanity and not dealing with Tren and Winnie and all that stuff, right? This is like the bread and butter for men.
Yeah.
So this isn't growth though, right? The Sermorelin, Testosterone, they're not actually growth. They're peptides that.
Well, if you think about just like growth hormone itself, growth hormone is released from your anterior pituitary. So generally when you get to sleep at nighttime, it comes out in more like pulsatile fashion. So it's not a steady level. Yeah, right, exactly. So it's not a steady state throughout the day. Kind of when you get into your deep sleep at nighttime, you kind of get more of that pulsatile fashion of that. And growth hormone itself, on the muscle tissue level, really doesn't have much of an anabolic or repairing effect. It's really like when it goes down to your liver and then releases the IGF-1. And the IGF-1 is the thing that's going to be more
insulin growth factor.
Yes, insulin growth factor 1. Yep.
Okay.
And they have the peptide IGF-LR3. They actually have a peptide version of that as well that you can take. But anyways, when you go to once that growth hormone goes down to your liver, it releases the IGF-1, and that's really where you're going to get, at the tissue sites, you're going to have more of that muscle repair and recovery.
So a lot more activity, a lot more, right?
Yeah. So when you're when you're younger as well, I mean, it's going to help you grow. Your growth plate's going to help you grow. And patients that have growth hormone deficiencies, don't grow as tall. So the Sermorelin has been around for a long time, and that one's FDA approved, and to increase your own natural growth hormone production. So it's used for FDA approval for people with, children as well as adults with growth hormone deficiencies. You can use it off label for what we use it for in Game Day, more for repair and recovery,
optimization.
I
mean, I've heard some, I know I didn't mean to cut you off, but I just want to clarify, right? Growth, I've seen in Hollywood and movies and actors and like bodybuilders, whatever, celebrities. You see like Sylvester Stallone, or you see The Rock, or you see Arnold, whatever. You see guys in their these much older, like 65 senior men that are shredded, like legitimately impressive.
Yeah.
And more often than not, it's associated with growth.
It's not just creatine.
No.
Yeah.
No. It's powerful. Creatine is extremely powerful if used correctly.
Great supplement.
It's not as powerful as growth.
Yeah.
But yeah, so I've always seen it. So the association of growth just being a game changer. You see the blocky abs, right? The blocky abs, the round shoulders. It's also very lean. It keeps you lean. I always knew like when I was in my bodybuilding days, when I was using test, high level bathtub stuff, not game day stuff. I got puffy. I didn't stay lean. And to see these guys do both, It's almost envious. I see these incredible results.
Well, just as you get older too, like if you have a 40-year-old and you have a 20-year-old, so just as testosterone declines with age too, like your growth hormones are going to decline with age. And these aren't super therapeutic doses that we're given. Like when you're doing growth hormone itself, like I said, it's more of like that pulsatile fashion.
If you want 2 IU a day, Monday through Friday, it's just really, yeah.
So if you're giving yourself super therapeutic doses, I mean, that's not what we're looking to do. We're kind of replacement doses, essentially, even with the TRT. Kind of same thing with the Sermorelin, too. When you kind of get those higher doses of growth hormone, longer periods of time, that's when you're going to run into some of the issues in regards to like the organomegaly, the cardiomegaly that can occur. You don't really see that with the growth hormone releasing hormones because there is a negative feedback and a little bit of a regulatory action when you're taking those. So if you're just giving yourself growth hormone, you're not going to have that... how should I kind of say? You're not going to be able to kind of put the brakes on a growth hormone. You kind of just
not going to have a governor.
Yourself. Yeah, exactly. Right.
Yep.
Yeah. So if you're doing the Sermorelin, so, basically you take it for the most part, some people take it in the morning. Generally the way I recommend doing it is more at nighttime. And I feel like it stimulates or it mimics more of your own natural physiology. So you kind of take it before you go to bed at nighttime. When you kind of go to sleep, you get that increased of your own growth hormone production at nighttime from the anterior pituitary. So it's kind of mimicking that.
Yeah,
and
but
then there's like a shutoff valve.
A lot of people argue that I'm with you, by the way. I'm with you. Increase the
What are you going to
boost.
say with that?
That, okay, you're saying you want to keep it at night, mimic yourself. Yeah. Well, why not just enjoy that or take advantage of the one at night and give myself another pulse during the day when it would never, ever pulse. So why are you 2 pulses?
Again, I think there's a difference between this isn't all just like bodybuilding. It's kind of when you kind of say performance aspect of everything. To me, it's not all gym stuff. It's kind of like performance for life. To me, kind of like getting up those stairs, kind of carrying that, heavy, bag wherever you're kind of going, like suitcase or whatever else. Kind of like that's kind of like the performance of life aspect of it. So to me, we're kind of doing that aspect of it. Yeah, if you want to kind of get big bodybuild, all that kind of stuff, yeah, you're going to kind of take these non-physiologic doses with that, where I think people then kind of run into trouble in regards to that. Now, some patients will take it in the morning. I just think it's kind of more for that nighttime to kind of mimic your own physiology. That's why I recommend that.
Sure.
But like patients you can take it in the morning and night. I think nighttime's the kind of way to go in regards to that, but that's kind of why I say that.
No, I'm in agreement with you. I 100%. I'm just I wanted to bring up, play devil's advocate to are you Jekyll and Hyde or Angel Devil? Just the contrast. You have a lot of people that are very passionate about wanting to take it in the morning. So, no.
Well, you'll hear a ton of different protocols out there. And there's a lot of like anecdotal evidence where kind of people just have like personal experiences. If you want to get better results, probably
add some
take more of it, but
add some insulin.
That wouldn't be kind of generally how I do that, but I'm sure you get other providers that may tell you otherwise.
Yeah, no, that is one thing we strive for. We strive to be optimal.
Yeah.
Not excessive.
Yeah.
All right. If you want to be excessive, do that on your own time.
Then honestly, it just gets expensive.
Expensive
it's more
and
medication.
And it catches up with you.
Yeah.
I will tell you that.
Yeah.
One thing I was going to actually say very briefly was, you will never, ever, ever need to bench 315 pounds off of yourself in real life. Okay. Yeah. You can make up all the scenarios of a car coming down on you that you need to bench yourself. If I don't bench 315, I'm going to die. It's like, no. So the amount of stress that you are putting on your joints, it's called wisdom. It's called maturity.
Yeah.
It's growing. You don't have to have that. It's better to bench 225 15 times than it is to put that stress on your body.
Yeah.
So like with this the growth releasing peptides, or stimulating peptides, Sermorelin, this is enhancing you. It is not altering you. All right. So I'd like to say that. So if you're on this pace, it's not going to knock you here or have you go that way. It's just going to have you go a little bit faster. It's going to keep you on your same pace, but at an accelerated rate. Are there any downsides, I guess, like drawbacks from stopping? Because I know if you come off test, like injections, if you come off test injections, you can feel pretty poopy very quickly. Are there any negative downsides to coming off of cycling off?
For one, like any side effects when you take the medication, when you inject the medication, you'll generally kind of feel like a little itching, a little irritation at that site.
Yep.
You might feel like a little bit of like flushing in your face. You might feel like a little elevation in your heart rate in regards to that. And that's kind of what some patients might experience early on. To me, that's kind of to be expected with some of that.
It's to be expected with 90% of the FDA approved anything.
Yeah.
Right? It's just anything that's injected or causes that type of bodily response. Your body's sending a signal saying this is a foreign object. Oh, wait, no, it's not. I recognize it. Okay, we're good. Yeah.
One of the things too with growth hormone, if your kind of levels are going up a little too high, you can get a little swelling. So patients might actually experience like a little carpal tunnel effect.
Water retention?
Yeah.
Oh,
yeah. Yeah. When I say kind of swelling, exactly. It's water retention. So, kind of to me, that's the patients that are abusing that a little bit more, but everybody's a little bit different. You can start, the same patient on the same dose of medication, and but you might see like a little fluid retention. You might kind of feel a little of that kind of carpal tunnel in your fingers. So I've only had one patient that has had that so far, but they also had a weekend where they're kind of out and slamming a bunch of beers and having a kind of a full-on weekend. So we don't know if it was kind of just to that weekend or
zero
not.
Controlled variables.
Yeah. Exactly. And then after that, after that weekend,
infinite hypothesis, zero controlled variables.
Yeah. But that's kind of some of the things that when you kind of talk about side effects in regards to that. Now, in regards to like contraindications, it's cancer, if you're taking
something else that you do not want that make 10 times worse.
Yeah. So, I mean, anything that's going to increase, growth essentially now it doesn't cause cancer. There's no evidence in regards to that. There's been patients that have been on this medication for years with the growth hormone deficiencies in children, and you're not seeing them with like increased tumor burdens or anything. But if you had an undiagnosed cancer that you didn't know about, could that cause it to grow more than normal? And the answer is we don't 100% know, but theoretically it makes sense.
So it doesn't replicate or it doesn't duplicate cancer cells, but it increases your own cells that in turn turn
if
cancerous.
You have a cancer cell, like it's not going to turn a cell cancer, but if you have a cancer cell, those aren't normal cells, but they can cause them just to grow like anything else. So to me, it can cause those cancer cells to grow more. So one of the things is, talking to your doc, it's like, do you have any risk of cancer, like family history of like any BRCA genes, things like that. Okay. So if you have a family history where you have, some of these genetic disorders, like I said, the kind of BRCA in there, that might not. Oh my God!
If you have an autoimmune or something like that,
well, to me, it's more these genetic things, kind of for the cancer aspect of it.
I'm just saying that
because even guys could have the BRCA gene. You always think about it with regards to like the breast cancer, but guys can have the BRCA gene as well.
So the guys that get their, what is it called when you gynecomastia, or they get you get that removed?
Well, I'm just saying the BRCA gene, like in women, kind of more known to give the breast cancer, but in guys, it could also cause
because the mammary glands. That's
outside of the mammary glands. It's not just a breast thing. Teach me. That's what I'm saying. It's not just a breast thing. So for guys too, it can increase your risk of like renal cell carcinoma. So there's other things along the lines of that. So it's not just breast, even though it's called BRCA. Okay. There are other kind of organs and tissues involved as well. So kind of point being, if you have a history of some of those things, you have to let your doc know, because you might not be the right person to put on that medication.
Yeah, don't lie to your doc. Tell him everything. Don't lie.
With active cancer, absolutely contraindication. Somebody that does not have known cancer but has some of these high risk factors, you might not be the right candidate for that as well.
Yeah.
Now, it does not cause cancer itself, but to me, you just kind of have to have that conversation about those things. Then you have to do your normal routine screening, like, do your colonoscopies, get your PSA checked. If you're a smoker, kind of go to your primary care to get your screening, x-rays for like lung cancer, all those kind of things.
There's runners, right, that have run for 40 years and all of a sudden get lung cancer out of nowhere, right? Never smoke a day in their life. And then there's Keith Richards that have had smokes for 70 years and lives to 95, and
good genes, man. Gotta have those good genes.
Yeah. Was it Levi's and was it Levi? What are the two big brands? Levi's and what?
It's about the jeans?
Yeah. Wrangler. Levi's and Wrangler built in one. But moving on now, we offer two. Correct? We offer two. Sermorelin, Testosterone. Well,
Testosterone, Testosterone.
Banana orange.
Yeah. Feel people all say that differently. 50-50 down that one.
So was it Testosterone?
Yeah. So the Testosterone is this one that's been around.
You studied pronunciations in pharmacology, I'm sure, a little bit.
I don't even know I'm saying it right.
Okay.
So people say Testosterone,
Yep.
But the same medication, just a little different.
But what's the difference between the two of them?
That one was more developed secondary to patients with like muscle wasting diseases. And when we kind of say that, like we were kind of talking earlier about patients that have HIV. So some of those medications you get, you know, for one, you go from HIV to kind of AIDS, you get muscle wasting syndrome. Even some of the medications that you get put on, the antiretroviral therapy medications, I think this is where it actually got its FDA approval, was for this specific purpose. So some of the antiretroviral therapy medications will increase visceral adipose tissue. It's called lipodystrophy. So that's kind of that belly fat
Just
around your midsection.
Makes you super fat.
Yeah, you kind of got that little apple body, kind of everyone kind of carries around their belly, also like covering your internal organs. And that's the one that is
the
more
yellow. So you always see that yellow fat on the diagrams or whatever.
Yeah, like you have fat around your liver, like the omentum in your belly, like that surrounds your organs, your heart. So that's the fat that's more pro-inflammatory. That's going to lead to increased risk of like metabolic syndrome, insulin resistance, increased risk of cardiovascular disease, heart disease, stroke, all those things.
Is it harder to burn, or less? I guess less willing to burn. Like the body can't burn it as well. It's like quote unquote stubborn, right? Is that what that is? Or
yeah, it's also just kind of where you put it on, because you have, you know, you see these patients that that kind of just have these like big legs, you know, and they got like a flat stomach, and that's just kind of where, you know, you put on your weight in regards to that.
Yep.
And but to me, genetics. Like if you have it like if you have it around your belly and you don't put it on around your legs, I mean, it's stubborn. Yeah, exactly. That's me, man. So it's like you could already be kind of like pretty low in your body percent fat, but if you carry it all in your belly, it's hard to kind of get those abs. You know?
Exactly. I gotta be under like 9% to have a six pack, but I'll have what, feathered quads. At 15%.
Yeah, exactly. And it's stubborn because that's like, you know, that's the last spot you kind of have it, and it's like, you know, to get down to that, you know, below 10 is pretty tough. If you're trying to get down to that 6-7 range, I mean, that's hard. That's not easy to do.
No.
Yeah. So this medication, worth it.
If you get the pubic vein right there under the belly button, if you ever experienced that, if you've ever had that, it's worth it.
Yeah. Yeah. And so this one was kind of developed for more that kind of exactly that stubborn belly fat, that lipodystrophy that patients get with some of these chronic diseases and disorders and everything, and some of the medications that they're on. And, but it also does, I mean, it's a growth hormone releasing hormone peptide too. So you get that lipolysis that's involved with it too. You're going to get a little bit of that increased recovery, help maintain some of your muscle mass along with it.
You'll be more active.
Yeah. And when you're on it for longer periods of time, you're going to see improvements on your triglycerides, your cholesterol, can decrease your non-alcoholic fat. Sorry, the mic went down there, guys. Back. Oh. The fatty
next
liver
episode
disease.
with the ED medication.
Right on cue, man.
Hey,
that was funny. But yeah, it can help out with fatty liver disease as well when you're on it for a longer period of time. So,
no, just the whole kitchen sink just fixes everything. Or
yeah,
at least
I mean, if you're going to help out with that belly fat and everything, if you're going to decrease your overall, fat tissue, I mean, you're going to have improvement in some of your lipids.
So I know you mentioned the negative side effects in terms of any injection site, right? Mm-hmm. That type of thing. And then of course was it contradictive, or what is it?
Contraindicated?
Indicated. Contraindicated?
Yeah.
Okay. And that has to do with, the adverse effects about basically, so other than those two examples, right? Mm-hmm. The common side effects that almost every injection comes with, mm-hmm. and then the specific cancer one, mm-hmm. are there any real negative side effects to Sermorelin, Testosterone, if used properly and correctly?
I think honestly they're pretty well tolerated, to tell you the truth. Outside of some of those things and a little bit of the swelling and water retention that you may get, I mean, there's pretty low side effect profile. There really is.
You get water retention after eating a McDonald's cheeseburger.
Some kettle cooked chips.
Exactly. So
Cheez-Its.
If that's it. Oh, so good. So good. Stop it. So now we've talked about how beneficial it can be, mm-hmm. and how minimal the side effects are at any level, basically, unless they're under drastic circumstances. Mm-hmm. So what can a guy, I guess we've discussed the side effects and the benefits of getting on tests, from the increased libido, the increased mood, energy, mm-hmm. strength, drive, mm-hmm. across the board. what can a guy expect when he adds a little bit of Sermorelin or Tesmorelin to his already testosterone replacement therapy?
On our previous episode that we were talking about the GLP-1s, the semaglutide, and the tirzepatide. So I think they're great to pair with those medications in regards to kind of maintaining your muscle mass or trying to maintain your muscle mass. So one of the things that we were talking about previously was if you're on the GLP-1s, it's doing your resistance training, right? To kind of like maintain your muscle mass. So one of the things with these medications, it's about like repair and recovery too. So guys that are kind of going to the gym 5-6 days a week, they're doing their workouts, they're kind of getting up early and they're really just kind of not seeing those same results. Some of those same results are due to the fact that you're not producing as much growth hormone as you did when you were 20, when you were seeing those results.
You're getting a negative ROI basically. Slowly each day you're going super hard and you're not getting back to baseline.
You're just not seeing the results. Like you used to go to the gym and you used to work out and you kind of see that hypertrophy, you used to see that strength gain, and you don't see that stuff as much when you get older. So it kind of, to me, helps out with that. It kind of get more bang for your buck with the work that you're doing in the gym. Yeah. And it kind of helps out with a little bit your energy, your recovery too. So, even some of the soreness in your joints, kind of muscles after that improves a little bit so that you can go to the gym, so you're not maybe as sore as you previously were in regards to that. So to me, it's about that repair.
It sounds like you still got to put in effort.
Always.
Exactly.
Always.
Yes, exactly.
Always.
But it sounds like you get a much bigger ROI. And like you get rewarded for your, so you could bust your ass instead of getting that little bit, you get that reward, or you get what you expect.
Yeah.
Right. And they match up. And, for a lot of guys, it hasn't matched up since they were like 25.
Same thing with TRT. And I've kind of shown two patients that are sedentary that take some of those medications, and patients also take those medications with resistance training. Now, if you look at the patients that are more sedentary, that even like increase your T overall too, you will see some of those body composition changes. You might get a little bit of that kind of like fat loss. You're like, your body percent fat might go down a little bit. Your muscle mass will go up. But of course, if then you're kind of putting in that work, you're going to get more of those results. And that's proven in regards to that. Yep. So if you do that muscle resistance training and everything, weight training on that, you're going to get more of that muscle mass and you're going to get more of that fat loss with either of those medications.
I've noticed personally when my testosterone levels increased, my stomach fat.
Oh yeah.
Quick.
That darn belly fat. Belly fat. Yeah.
And then, when I was stressed.
Yeah.
When my cortisol levels were raised, when my test levels were a little low, everything. I could eat under 30 grams of carbohydrates. I could eat restricted diet.
It's tough to go under 30 too. That's low.
What?
It's tough to go under 30. It's low.
Oh yeah, it's trace carbs.
It's hard to do.
It's trace carbohydrates for sure.
Yeah.
I was doing 45 minutes of stairs at 80 pace per minute for 45 days, 5 days a week, not losing a single pound.
Yeah.
Because of, your body is just it's in starvation. It's in, it's protecting itself. And I had pushed this up. So, but that was before I understood carbohydrates and diet and all that stuff and letting the body fasting. Oh my God. But that's where, that your body composition, and I think growth releasing peptides or stimulating,
growth hormone releasing hormones,
it can change your composition.
Oh yeah.
It changes.
Well, it increases lipolysis, kind of like that mobilization of those fatty acids from your fat tissue. So you do get that just by having increased levels of growth hormone. So yeah, absolutely. Yep. Also helps out with that deep sleep, man. Like that's when you get that growth hormone kind of like release at nighttime. So patients will also kind of feel that they get better, more restful sleep.
I've heard also the people that claim that they want to do it in the morning and they get that second pulse. They get very tired throughout the day. So that would make sense. Again, another benefit to do it at night where you're naturally doing it. Now, it helps you fall asleep, stay asleep, stay in a deeper sleep?
I don't think it keeps you asleep. I think it kind of helps you to get to sleep.
Get to sleep. Okay.
If you're kind of getting at 3 or 4 o'clock in the morning, kind of wake up, it kind of like induces it. I wouldn't say it kind of sustains it.
Okay.
That sustaining is tough. That's a tough one. Everyone's kind of looking for that.
What the
sustaining the sleep. You get things that kind of get you to sleep, but it's kind of like staying asleep through the entire night, which is the hard part.
Oh, I'm the opposite.
Oh, really?
I struggle. Yeah. So like ADHD, it's hard for me to shut off.
But once you're off,
When I'm off, I'm done. And
you're just kind of good to go.
What sucks is it's hard for my brain to turn off.
Do you wake up in the
It's also
middle?
hard to turn my brain back on.
Do you wake up at all in the middle of the night? Never. Oh, really? Because I would think that's
Through
like when you wake up and then you start. See, I wake up and then I start thinking about stuff.
If I ever do,
then it's hard for me to go back to sleep.
Yeah, if I ever do it by the off chance, right?
Yeah.
I don't move.
Yeah.
I don't breathe. I don't get up. I don't shift my body or focus on anything. I'm just like, just go back to sleep.
Yeah.
Because if I think of one thing, it'll race.
Yeah.
But no, I stay deep sleep.
Yeah.
Yeah. It's good. But I can't wake up.
Support, man.
I can't wake up.
Support.
It comes with take the good with the bad.
Yeah. Yeah.
But so you'd said again about the cancer. Bring it right.
Yep.
What labs or markers should be monitored when combining TRT and Sermorelin? So when you go and you go to game day, you get your blood done, blood sent out, analyzed, gotten back for free. That reading, that panel, what markers should they be paying attention to?
There's generally not many markers that you really use when you're on the peptides. You can get IGF-1 levels on that. I mean, you don't really you don't really get growth hormone levels, but you can get IGF-1 at game day. We don't send off the IGF-1 panels. You can get them. You'd have to pay for them. And kind of in our package, we do that one kind of fee for the labs for the year, but that's really kind of monitoring all the testosterone, TRT, lab work, getting your total T, your estrogen, following your PSA, your hemoglobin, your hematocrit. So we don't
all of that is included in the free one.
Yeah.
But you do have the option. You're saying you have the option if you want IGF out there?
Yeah, there's different labs, different locations use different labs, and you can get IGF-1. It's more of an expensive test, and so that'd be like an out-of-pocket cost that you'd have to talk with like your local game day or whoever else that you're kind of seeing to ask them to send off that test. But I know it is a little bit more of an expensive test, but you can get it. But that'd be the test that you would be looking at if you wanted to get your essentially your growth hormone levels checked, would be an IGF-1.
Okay. That makes sense.
Because
you were saying that originally it creates, right, and then it processes, gets processed down to the liver.
Yeah.
Right,
the growth hormone will go to the liver, then it creates the IGF-1. And the IGF-1 is kind of really kind of doing that heavy lifting in regards to like the anabolic effect, kind of when you break down that muscles when you're trying to get that tissue repair and recovery. It's really IGF-1 doing that.
Got it. Exactly.
Yeah. I think I've even heard of, I guess, in vitro studies, like in a dish with cells, you can put growth hormone in those cells and you won't see them activate. But if you put IGF-1 in, you will.
Really?
Yeah. Yeah. So it's really IGF-1 that's kind of doing the work.
So the growth is the antagonist, and then or not the antagonist, but the precursor.
Yes.
Right? And then IGF is the main event. So I mean, as with tests, as with GLP-1s, as with everything, peptide, what's the most common misconception you want to clear up about Sermorelin, Testosterone, whatever?
What'd you say? The most.
What's the most common misconception? What is everyone getting wrong? What is
I think everyone thinks that you're doing this stuff like you're cheating, you're being weak, or it's like for just like bodybuilders. I think that's kind of the main misconception. Like that's not just what it's for. To me, it's kind of for that guy that's like 50 and 60. It's not all for kind of like, young guys. That I think the younger guys are a little bit more aware of these kind of things. As you get a little bit older, they may not be on like listening to podcasts and YouTube as much. I'm not saying they're not, but just kind of percentage wise for the population. So I would say the biggest stigma to me is that people kind of think it's like you're cheating, you don't have enough willpower, and that you're kind of just trying to do bodybuilding and like get big. And like, to me, that's kind of not what it's about. It's about kind of being really kind of aging more successfully. As you get older, kind of keep that muscle mass,
quality of
life. That's exactly it, man.
And
so
if quality of life is a sign of cheating, And
If you-
sign me, yeah.
If you were kind of younger and you knew you could be like 90 years old and kind of running around and having a good time, like when you choose to do that,
But no, you're a cheater.
it's like you don't have to be 70, 80 and kind of sit in a couch and stuff. I mean, it kind of depends what you're doing when you're kind of 30, 40, 50 as well. Like, are you doing all the preventative things? Are you being active? Are you taking care of yourself? But if you do all those things and you supplement kind of where you need to, you can age better. You can kind of live a longer, healthier life. And to me, that's what kind of really the goal is overall. Like as you're getting older, playing with your grandkids, kind of doing the things, not always relying on somebody else to kind of pick you up out of a chair, kind of having that muscle mass in your quads to kind of get up, take care of yourself, like live, by yourself. As you get older too, patients could get a little bit more weak and frail and, increased risk of long bone fractures, osteoporosis. One of the things that growth hormone and testosterone will do is increase your bone density. If you kind of don't have those like growth molecules or growth hormones, like as you're getting older, you're going to increase that risk. If you want to live by yourself when you're, older, like you and your wife, whatever else, you don't want somebody to help you out, kind of take care of yourself well. And some of this stuff will help you do that as you age. That's the way I look at it.
Oh man,
right?
It's the fountain of youth.
Yeah,
that's how I was introduced to the world of growth. The bodybuilding. That's what my first terminology I remember is. It's the fountain of youth. It's like, what?
Well, it's good for skin, hair, nails, all that stuff. Mine's falling out. We've talked about that. Wish you would bring that back. It's not going to do that.
Nope. I was Winnie back in the day.
Yeah.
I watched it fall out. Never came back.
Yep.
So we've talked about the combination. We've talked about the side effects. We've talked about what's good. We've talked about, the benefits. We talked about here's a question. How does it affect men and women differently? Or does it?
I don't know if it, obviously men and women are different, but I think overall in the end, you're trying to get to the same goal with that.
So we got some athletes out there, right?
Yeah.
Women, right? The CrossFit athletes, bikers, swimmers, triathletes, marathon runners.
Yeah. No, women could take it all the same. The growth hormone releasing hormone, you're not going to get any, it's not an androgen. It's not going to give you any virilization, masculinization, anything else like that, kind of completely separate. To me, the growth hormone in women is really going to do the same for it would in men overall. Increase that lipolysis, kind of help out with maintaining your muscle mass, increasing that bone density as you age, or decreasing the loss of your bone as you age. And I really kind of think it has the same effects in regards to that.
Yeah. Yeah, right. I think, we forget. We discussed it with GLP-1s, I think, a little bit, but we are game day men's health.
Yeah.
But we are not exclusively men. We do see women.
We don't do any of the hormone replacement therapy for women.
No, that is exactly. But we do Botox.
Yeah. Guys come in with their wives. They're both on their weight loss journey or kind of, sexual health, kind of different things where, guys are getting their, TRT and then
she's getting poked. He's getting poked. It's just
one of the other, FDA approved peptides we have is the PT-141, which is actually FDA approved in women for a hyposexual dysfunction disorder. And so
for
guys,
menopause, or is it typically seen?
It's just like, it's essentially like low libido in women.
Okay.
Just as you get older too. So it's FDA approved for women for that. And but same thing, guy's starting to get his TRT, he's chasing his wife around. She might not have that kind of same drive any longer. So they can take the PT-141 to assist with that.
Oh, right. One-stop shop again.
Yeah.
Right. Are we couples therapy or a health clinic? There was one point.
Bit of both.
Yes, bit of both. Exactly. There's one enhancement, right? Or there's one like synergistic effect that TRT and growth have it's the signaling efficiency, right? It increases the signaling efficiency, the IGF-1 signaling efficiency. So it makes it more bang for your buck. The growth, does the test make you or allow you to use whatever growth you do have to its max, or no?
I'm unsure. I don't know. Are you saying like, does the testosterone itself help upregulate the growth hormone or anything?
And increase the amount of IGF-1 that's
there
produced.
Might, I'm not sure. I don't know the answer to that one, to tell you the truth. There may be some info out there that I'm unaware of in regards to that. But to me, they act a little bit differently to me, they kind of work synergistically together, kind of to accomplish some of those same goals. But I'm not sure if there's a direct connection. Not saying that there isn't. I just
in theory, it's just like your body's optimized or your body's running at a higher level with higher tests. So in theory, the amount of growth that you have, of course, you'd have a ceiling if you have 100 growth, right?
You're going to get more with both of them.
Yep.
You're going to get like more repair and recovery.
Okay.
Yeah. Than like one alone. Yes. Yeah.
I think that's all I got. Would you like to add anything?
I think we covered it, man. I think we hit them all up. So, I mean, you want to come on in, talk to myself over at ACO, talk to Dana. She's great over at the Swedesboro location. She's very knowledgeable on all these different peptides and hormone replacement therapy. So I think we covered pretty much what we wanted to cover, man.
Yeah, this was a good one.
Yeah.
All right. Yeah. I think hopefully it's all recorded.
Yeah.
All right. So my name is Manny Cambra. This is Dave Grosiak.
Have a great New Year's, guy.
This is, of course, sponsored by the location in Swedesboro, the Game Day Men's Health in Swedesboro. The Frosted Nug at Carney's Point is where we are recording and broadcasting today at this dope, very fortunate podcast studio we have here. So this was Testosterone and Sermorelin. Check our previous episode, was combining testosterone with GLP-1s. If you have any recommendations or you want to see another episode that maybe appeals to one of your personal needs, send in a request. Comment below on the video and let us know what you want. Let us know what you like.
All right. Thanks for listening, guys.
All right.
Take care.
See ya.